Hi, I'm Anne-Marie Boxall. I'm the Senior Policy Advisor at the National Rural Health Alliance, and I'm here with Lesley Fitzpatrick talking about the 13th National Rural Health Conference, which is coming up in May. So, Lesley, can you tell us what is the Sharing Shed?
It's a website that's been developed for people who are participating in the National Rural Health Conference to enter recommendations that they would like to see go forward through the conference process.
Okay, so what kind of recommendations would people make?
It would be in their area of expertise or in an area that they see is really crucial for rural health development, so they might put together something that they think will progress that issue.
Mm-hmm. Okay, so it sounds like a valuable initiative. Why has the Alliance gone to the trouble of inventing this process and doing it at the conference?
The Alliance wanted to really honour the commitment made by the people and the organisations that come to the conference. When you think about it in terms of an investment from those groups, there's a huge amount of money, I guess, wrapped up in people's time, airfares, accommodation. The other thing is that all of those people have incredible expertise and on the ground knowledge, and what we wanted to do was to capture that so that it can input into the policy development process.
Yep. Okay, so say I'm a participant at the conference, what would I do if I wanted to make a recommendation?
You go onto the website and you can select a theme, write your recommendation in. You can also vote for other recommendations through liking them, and keep checking back and see the progress of the recommendations or add more as you go through the conference.
And the website's the Sharing Shed website, is it?
That's right,
Yeah,
yes.
Okay. Well, it sounds like a pretty good process and one that people can get involved with. Is there a way, if people don't have an iPad or an iPhone, can they still get involved in that?
Yes, we've got a process where they can fill out a recommendation on paper, and that'll be input by Alliance staff.
Great. And what happens at the end with all of these recommendations?
They go through the conference recommendations committee, and they look at emerging themes, synthesise issues, perhaps add to recommendations, and also identify things that may not have been picked up by the conference groups. These are then put into 11 or 12 priority recommendations that are presented to the Health Minister at the end of the conference. Then those conferences are circulated to all groups, including the Alliance itself, for them to look at to see whether or not they want to adopt them and use them as part of their policy development and lobbying activities over the next 2 years.
Great. Well, it sounds like a really wonderful way for people to get involved and try and influence policy and improve health and well-being for people in rural Australia. So thank you very much, Lesley.
Thank you, Anne-Marie.